In this segment, we're going to take on some of the big issues like healthcare. Begin by separating it in separate categories, linking it to public service, and changing our tax codes to get the employers out of the role of middlemen. First of all, let's talk about clarifying our terminology and breaking a big problem down into smaller problems. My training in problem solving was to approach a big problem by looking at how you could break it down into smaller ones and solve them individually. Let's begin with that. I suggest we create 6 categories to facilitate choice of appropriate solutions. Those categories would begin with prevention, such as providing prenatal care, dental and eye checkups, vaccinations, nutrition advice. Emergency and acute care, broken bones, car accidents, toothaches, that type of thing. Third are chronic conditions, things like diabetes and heart disease. Then the major unexpected surgeries that everybody doesn't have. These are the kinds of things that health insurance is designed to handle. End-of-life care, housing, drugs, and those kinds of issues that deal with that. And then elective procedures, like eye lifts and so on. If we define these categories 1 through 6, we can refer to different solutions and ways of paying for them individually and choose the right combination of private and public sources of money. Now, to begin with, I suggest we have to cut out the middleman. The insurance, we've separated the cost of health care from the customer and put the employer in the middle. This was based on giving a tax, not taxing health benefits and putting the employer in the position of buying the health benefit from a supplier and giving it to their employees. The problem with this is the costs are just increasing dramatically. In 10 years, from 2005 to 2015, prices went up 61%. And from this chart in the light blue, you can see that the worker contribution went up from 2,700 to 5,000, but the employer contribution went up even more. So that now per worker, we're looking at health insurance premiums running from almost 11,000 to about 17,500 per worker per year. This is a major expense for companies, and that doesn't include all of the time and effort it takes to administer this kind of program. So I suggest we make the consumer the customer of healthcare providers by removing the tax exemption for employee health plans and do a one-time wage increase to offset, to help the companies compensate the workers for those negotiated deals, but get the company out of the middle and put the money in the hands of the worker. Remove the cost of healthcare from a company's products. Make them more competitive. Let the company focus on their core business instead of also being a parental figure of providing care and benefits to workers. Because once the consumer starts appreciating how much something costs, they can have choices. Few of us know what an MRI costs, or the difference in cost between getting an MRI at one hospital versus the other, or a new model versus an old model. So once we know the costs, we can make some choices, and that would help keep costs down. So I propose that everyone should get basic health care. And by basic health care, I mean categories 1 and 2. So individuals could subscribe to a monthly plan for a flat fee. And providing everyone with category 1 and 2 health care, especially prevention, is good for everybody because it prevents the spread of disease. It helps reduce prenatal damage to infants that can result in long-term healthcare costs for everyone. So in general, this kind of stuff actually saves money for everyone, which is a good reason to make sure that everyone gets it, even if the government has to pay for it. I propose, however, that everybody does pay something, that there's a monthly fee, and the idea of a flat monthly fee comes from my experience with the internet service model. Back when initially we were looking at getting online, companies were charging by the minute, and people just didn't do it. They didn't want to pay by the minute. And then companies like AOL came out with an idea that, okay, for a monthly flat fee, you can use it as much as you want. And all of a sudden, use exploded. So similar to cell phone plans or other plans like that where there's a flat fee per month, you wouldn't feel like you were incurring an additional cost by taking your kid into the doctor to see what's wrong with them. Or bad cold, or perhaps they hit their head. You want to check and see if they have a concussion, things like that. So that I would apply to category 1 and 2. So I would want to make sure that everybody paid something, but the government would look at income and offer to pay part of the expense to make sure that everybody could afford it. There would be different providers similar to different cell phone services and things like that today, and people could choose which group they belong to, and cost would be one of their choices. So market forces would help keep costs. Next, I would link healthcare benefits to public service. Instead of just giving everybody full, complete medical care, I would tie it to public service. So we've talked about public service in a previous section, and so one of the great incentives for doing public service would be to qualify for healthcare benefits. So I'd link it to the amount of service. For example, 20-year veterans in the military, the diplomatic, and the disaster relief corps would get full medical benefits equivalent to whatever the U.S. Congress has voted itself these days. If you were in one of these areas and you did less than 20 years, you get a proportional benefit. If you did 10 years, you get half of full benefits. The Domestic Service Corps of 2 years would get supplements in categories 3 through 5. The amount to be determined, but that would be a big incentive for doing your 2 years, for you get a lifetime health benefit supplement. For other ideas associated with Vision for 2020, you can go to my channel at YouTube or go to pctraining.net/vision.htm.